Now, I would like to show you some techniques of some types of transfers, and I'd like to actually demonstrate some of these transfers for you. There's just a couple of different techniques I'd like you to be aware of for bed mobility when you're moving a patient in bed. When you need to roll a patient to the side, make sure that you roll using their joints of their knee, hip, shoulder. Instead of rolling them as a log, you'll find it much easier if you can get them to assist by reaching to the opposite side, either to the bed rail or to the side of the bed. Have them bend up the leg closest to you or the leg opposite of the direction they're rolling, and then have them roll, and you can assist at the shoulder and the hip. Okay, same thing coming back. They would just shift over and bend up the opposite knee. You would explain to them to help reach across the bed, and you'd help roll this way. Also, just to be aware of, if you need your patient to lift up in bed so that you can position sheets, help them to move up in bed, be aware that you can have them bend their knees up. And we had mentioned earlier that you can raise the foot of the bed up so that gravity can assist. But this way, if their knees are bent up, they can help with a push. Sometimes there's a trapeze that hangs over the bed, and they can grab a hold of that and help with a pull. Many times all you need to do is explain to the patient you need them to lift up as if you're putting a bedpan under them. They'll understand what that means. Okay? Very good. And that way it's easy for them to shift side to side or for you to rearrange or position things. There's also times when you may not have another caregiver to assist you, and if you can get the patient into this position before you need to move them forward or towards the head of the bed, then if you can cradle near their knees and help up near their shoulders, they can push with their legs to give you some assistance with that movement. What I'd like to show you now is something that's called dangling. Dangling is usually an intermediate step that's used between the patient being bedbound for a long period of time and when they will get up and start moving around. The reason that dangling is important is because a lot of times if somebody has had surgery and they haven't been sitting up, they need to be in an upright position to help with circulation, to help prevent blood clots. Also, some elderly people, many elderly people are on high blood pressure medications. And what happens is the circulation system needs time to adjust between positions and movements. So what you would do if you have an order to dangle a patient is that you need to make sure when you come in that first you explain to them what you're doing. Be very sure to reassure them, tell them that you'll stay right with them, and that they need to sit up on the edge of the bed for a short period of time. Make sure that your patient is properly clothed so that they have on a robe or a bathrobe so they're covered when they're sitting. Once they're up, you may want to put a blanket around them or over their legs. With dangling, you want the bed in the lowest position, and to assist with that patient coming to a sitting position, you'll use the electric bed. I just want to mention, prior to getting them up, you will want to take their pulse. You'll need to be taking their pulse before, during, and after the dangling time period. So take their pulse, reassure them, explain to them, and then we'll bring the patient into a sitting position. Okay, now the bed can be assisting with this movement. It's also kind of a slow way to ease them into the sitting position. Once they're up enough in bed, I would explain to the patient, Mrs. Jones, I'd like you to try to get your legs over the edge of the bed now, and just turn yourself and sit on the edge of the bed. And because these patients may be weak, you'll probably want to put a pillow or two behind their back to support them. Always stay with your patient while you're doing this, and you need to observe how they're looking, anything that they're saying about how they're feeling. When the patient is in this position, you'll have them just do some leg movements and explain to them, I just want you to swing your legs a little bit in front of you. swinging their legs, moving their ankles, their toes, just getting some movement. And then I'll be observing if my patient is getting very pale, or if she's saying that I feel dizzy, or I have more pain than I had when I was laying down. These are all things that would give me a cue that I really need to lay that patient back down and then report those things to the nurse. But if Mrs. Jones is doing fine, then I let her sit and dangle for whatever the prescribed amount of time was that I was told to dangle my patient. And when she's dangling, I'll take her pulse for a second time and record that. And when we're done with that, then I'll tell her we can go ahead and lay back down. So I'll move the pillows back up so that they're in position. And then just explain, Mrs. Jones, if you can get your legs back up into bed. I'll lower you back down to a lying position. Okay, now I'll lower the bed back down so that my patient can return to a lying down position in a slow, comfortable way. I've positioned the pillows under her head so that she's comfortable. And when your patient is done with dangling, don't forget you want to take the pulse for a third time so that you can get the before, the during, and the after pulse. When you're all done with that, make sure that you record how long you had the patient dangle, what the 3 pulse readings were, and any observations or comments that the patient made while they were dangling. And then those things would be reported to the nurse. So just so you're aware that that's what dangling means, and there will be many times that you will probably be asked by either the nurse, the physician, or the therapist to dangle your patient. I'd like to now demonstrate to you a one-person pivot transfer. This is a type of transfer that you will probably use very frequently. What you need to be aware of with this type of a transfer, as some of the safety issues we talked about before, you need to make sure that you've got what you need in the room, that you've got your safety belt. Make a quick visual inspection of your wheelchair or whatever surface you're transferring your patient to. Make sure that the brakes work on it and the leg rests swing away, just to make kind of an inspection to make sure things are prepared for your transfer. With a one-person pivot transfer, if your patient is lying in bed, you'll need to help explain to them that you're going to get them onto the edge of the bed and then transfer from the bed to a wheelchair. So I would explain, Mrs. Jones, what I'd like you to do is roll to your side. So I want you to bring your knee up, roll this way. I won't let you come off the edge of the bed. Now bring your legs over the edge of the bed. And I would like you to push with your hand and your elbow into a sitting position. And this way I can help her from a sideline position into sitting. It's much safer for their back, and it's usually a much easier way to get your patient from lying down to sitting up.